Hello everyone, welcome to Quick Online Pharmacy. As we promised to bring to you common diseases that are common in people, diseases that are common in the society. So today we are going to look at hypertension. Hypertension, which most people call high blood pressure, because we have hypertension and hypotension. So hypertension is low blood pressure and hypertension is high blood pressure. So these are all diseases. So I'm Dr. Sharif by name. First of all, we are going to say what is hypertension. That will be the first question someone will ask yourself. What is hypertension? So hypertension, this is when blood pressure is too high, beyond normal. So what may be the norm? Because hypertension is high blood pressure which is beyond the normal. So it means there is a normal value for blood pressure. So when the pressure goes high, that is hypertension. When it goes low, beyond that value, it is hypotension. So we shall also make, I think, another video about hypertension, but let's first make this one of hypertension. So there are also devices that can be used to measure hypertension. So I think those people with high blood pressure, they have ever seen such devices. So what are the normal ranges of blood pressure? So the blood pressure is measured in two values. It is given in two values. We have the systolic pressure and we have the diastolic pressure. So even when you look at the machine used to measure blood pressure, this is how it displays. It displays 123, that's the historic value, and then there is 94, that's the diastolic value, and then there is that 123, which is the pulmonary value, but we want to look at that. So for a normal person, the systolic value should be less than 120 millimeters of mercury, and the diastolic value should be less than 80 millimeters of mercury. But these values change according to age. Because that of a child is not the same like that of an elderly person. So for young people, like kids, children at home, so those ones before, which are in the age of the preschool age, like those who are not yet in that age of going to school, they might have a systolic blood pressure over 95 to 110 millimeters of mercury. Then the diastolic may be between 56 to 70. Then for school going children, it may be between 97 and 112 for systolic, and diastolic may be between 57 and 71 millimeters of mercury. For adolescents, it may range from 112 to 128 for systolic, and for diastolic may range between 66 and 80. So for elderly, you may find that elderly people have a high blood pressure. So even in causes of high blood pressure or hypertension, you may find that aging is also a. So when you are an elder and find that your blood pressure is too high, like that shouldn't scare you. Just go and seek medical attention. But this blood pressure, the 128 for systolic, be below 120, that's for a normal person, and the diastolic is below 80. So we have these two conditions. Because we have the normal blood pressure, then we have the pre-hypertension, which is when you have this pressure, you are at risk of getting hypertension. If your blood pressure, the systolic range is between 120 and 139 millimeters of mercury, and the diastolic range is between 80 and 89, so you are in the pre-hypertension condition, so you are at risk of getting hypertension. Remember, the normal for systolic is 120 and for diastolic is 80. So if you have 120 to 139 and you have 80 to 89, then you are at risk. You are in the pre-hypertension condition. And then when do we say that you have hypertension? So this is the last condition. That is when you have a systolic blood pressure of 140 millimeters of mercury, or higher, and the diastolic you have 90 millimeters of mercury or higher. That's when we say that this patient has what? Hypertension. So we are going to look at the signs and symptoms of hypertension. What do you base on to say that I have hypertension? What do you base on to say that maybe I have hypertension? Let me go for what? For medical checkup. We have when you get dizziness. This regular users, you get dizziness today, you get dizziness tomorrow, you get dizziness in the morning, you get dizziness in the evening. That may be a sign of what? Hypertension. When you have an irregular heartbeat, like your heartbeat increases, then decreases, increases. When your heartbeat is not stable, it's better you go for what? For medical checkup. If you have nausea, this one is it's like that uneasiness you get in the stomach, like which you feel like you want to vomit but you're not vomiting. That one may also be a sign of hypertension. Vomiting. If you get constant vomiting, you vomit, then you after 2 hours again vomit, after some hours you also vomit, you feel like vomiting. That's also a simple sign and symptom of what? Hypertension. Fainting. You may find some people are like fainting is a common thing to them. They faint after some minutes, again faints, after coming back spends like 1 hour, again faints. So if you get those regular fainting condition, like it's better if you go for what? For medical checkup for hypertension. Fatigue is like a feeling you are overtired, you have low energy, you feel like you have the desire to sleep. And this may also interfere with your daily schedule. So also fatigue can also be a sign of what? Hypertension. Headache. This regular headache, you get headache, someone is feeling headache, that one can also be a sign of hypertension. And then numbness is like it's like a kind of stroke, but you feel some body part, you lose feeling for some body parts. Like you may no longer feel your leg, you may no longer feel your arm. So that is called numbness. It's also a sign of hypertension. So we can come to the causes of hypertension. What causes hypertension? So first we begin with diabetes. In most cases, diabetes and hypertension, they're like brother and sister, or let me call them even twins. In most cases, people who have diabetes, they have hypertension. And people who have hypertension, in most cases, they have what? Diabetes. So it's better if you have diabetes, you go for checkup for hypertension at least every month or every 2 months. So it's the same way. Like if you have hypertension, it's better you go for what? For diabetes checkup. And then obesity. Obesity is the abnormal size. Like someone has an abnormal size, like someone is big, beyond normal. So these are also what, like they are also at risk of getting what? Hypertension. So if your size is obesity, it's better you go for what? For checkup for hypertension. So aging, as we said, elderly people are at a risk of getting what? Hypertension, because this blood pressure increases with age. So these aging people, they have a high risk of what? Hypertension. So the more someone aged may also be a cause of what? Hypertension. Kidney diseases like kidney failure. Okay, there are very many diseases of kidney, but most kidney disorders are causes of hypertension. So if you are diagnosed and you were found to have a kidney disease or a kidney disorder, it's better you go for hypertension checkup, because your blood pressure is all like a kidney plays a major role in regulation of your blood pressure. People who are smokers or smoking can also be a cause of hypertension. And then decrease the cardiac fitness, like cardiovascular fitness, like you lessly do physical exercise, so your heart, your veins and your arteries are not functioning well. Yeah, like they are not fit to that extent they should be. That may also cause what? Hypertension. Increased blood volume. If you have too much blood in your system, in your body, it may also cause hypertension. That's why it's better to do blood donation. Yeah, it's good to do blood donation. If you feel like you are able to do blood donation, it's better you do blood donation, because now you see, increased blood causes what? Increased blood volume causes hypertension. So it's better you do blood donation. Genetic disorder. Yeah, hypertension is not only acquired, but it can also be genetically acquired by a person, by an individual, like from parents to the children. Because when you look at the causes of hypertension, they are like divided into 2 or 3, because of the primary and the secondary. So this genetic falls under primary causes. They can be inherited from parents to children, hypertension. Then potassium deficiency, because when you look at this potassium, it has a less extent which it attracts water back into the blood. And remember, when you have too much water is attracted back into the blood, it will increase the volume of blood, which will increase what? Blood pressure. So unlike sodium ions, potassium ions have a lesser extent what? Attraction of water back into the blood. Now we are going to look at medicines that cause hypertension, because they are drugs that you take and your blood pressure what? Increases. Yeah, there are those drugs that you take and your blood pressure increases. So like when you take them, you shouldn't, when you see your blood pressure is increasing, so you shouldn't worry. Or when you see you have a high blood pressure, it's better you leave them so that your blood pressure comes back to normal. So we have the contraceptive pills. These pills have a tendency of increasing what? Blood pressure. We have the steroid drugs. We have the NSAIDs, like these are non-steroid anti-inflammatory drugs. They also have that tendency of causing hypertension or increasing blood pressure. So if you are like, if a doctor or a pharmacist prescribed you these drugs, you can what? And you find yourself having high blood pressure. Yeah, you should know what is these drugs causing the high blood pressure. So you either leave them or you talk to your medical personnel, either your doctor or your pharmacist. Any medical personnel you have, you talk to them, you say these drugs bring me hypertension. So they either tell you like the way forward, they'll give you the way forward. We have some cough and cold remedies. Yeah, they can also cause hypertension. We have herbal remedies like those that contain licorice. They can also cause hypertension. We have recreational drugs like cocaine. Cocaine causes also hypertension. We have antidepressants. We like now, as I say, these drugs, when you take them, when you swallow them, when you use them, they can cause what? Hypertension. But in most cases, when you leave these drugs, your blood pressure may go back to what? To normal. So when we come to see about the complications, like what does hypertension cause? Like when I have hypertension, what may be the effects? What may be the effect it has on me? Yeah. So hypertension, first of all, it can cause heart attack. Yeah, hypertension can also cause stroke. So heart attack, I think, it's a common word, heart attack. Yeah, so if you have hypertension, you are at risk of getting what? Heart attack. And then stroke, this is when your body freezes, you can no longer feel your body, any part of your body. And this is the most comes from the brain. See, this hypertension, like when your blood is moving at high blood pressure, has very many complications can cause, mostly on your blood vessels. Now, like when you look at the brain has those small blood vessels that supply it with blood and nutrients. Yeah. So if your blood is moving at a high pressure, it can cause them to rupture. So when it ruptures, any mistake or any complication caused on the brain, it will affect your central nervous system, which may either hinder your blood coordination, like the nerves won't be able to transmit impulses to that specific part of the brain where the blood vessels have ruptured. So it may bring a lot of complications. So that's where stroke also comes in. So we have aneurysm. This is you have because these blood vessels, you see, like you might have a weak spot somewhere on the blood vessel. So when the blood pressure is high, so you may form something like a balloon on that specific part. Blood may enter there and form something like a balloon, and this balloon, as blood goes on entering there, because it's moving at a high pressure, this balloon may end up bursting or rupturing. We have heart failure. We have dementia. Dementia is like loss of memory or decrease in memory capability. Yeah. So this also comes from rupturing of of blood vessels in the brain, those tiny blood vessels in the brain due to high blood pressure. So they rupture in the brain. You may find even clots in the brain. Yeah. So this one reduces the memory capability of the brain. So we have kidney damage, because this high blood pressure may also rupture those small blood vessels in the kidney. Yeah, it may also make them rupture because the blood is moving at a high blood pressure. Loss of vision. When you look clearly in the eyes, you may see those. You can be able to see the tiny blood vessels in the eyes. Yeah, those tiny blood vessels may also rupture due to the high pressure of the blood, which may cause someone to lose vision. Erectile dysfunction. This one's like married men. You may find that you have reduced manpower, but this one may also come from hypertension. That's why if you have this condition, like your manpower is low, it's better you first go for hypertension checkup. Yeah, because when you look at the muscles of male reproductive system, they work with blood pressure. Yeah, so when blood flows to that specific part, it's able to stand erect. Yeah, so when blood is flowing at a higher pressure, is what we call fatigue. The muscles also undergo fatigue. Yeah, they will fail to do their work. So in most cases, people have this problem of low manpower. It's because of the pressure. So that's why it's most important to go for hypertension checkup at least every month. How can we prevent hypertension? There must be these that which, apart from the genetic one, but these other causes which are just acquired causes, you can at least prevent them. Yeah, this is how you can prevent hypertension, either by your feeding, physical exercise. Yeah, let's look at them and see. Now we have increased activity and exercise more. Yeah, do physical exercise regularly. Yeah, do physical exercise regularly. So it will help you to. First of all, we saw this. We saw a decrease in cardiovascular fitness. So this exercise may increase your cardiovascular fitness. If you have fats that had clotted in your blood vessels, yeah, they will get relieved. So it's good for someone to do physical exercise. So we have, if you are overweighted, like as we talked about obesity, it's better you follow everything you can do to lose weight, because obesity is also a major cause of hypertension. So when you lose weight, you are safe. Cut back on sugar and refined carbohydrates. Yeah, those people who are used to taking carbohydrates, refined carbohydrates. Yeah, when you reduce them, you have reduced your chances of getting hypertension. Eat more potassium than sodium. As I talked about this, potassium are less water attractive than the sodium. Yeah, and you see these ions are most important in the kidney, as we say, because when you look at the excretory cycle of a person, like if you have more sodium in the blood, so when this water is filtered out, the sodium will again attract the water back into the blood vessels, and too much water will increase the blood volume, and the blood volume will increase the blood pressure, causing hypertension. So eat less processed food. Stop smoking. Also, smoking is one of the causes of hypertension. Reduce excess stress. Try meditation and yoga. This one will help you to cool down your circulatory system. And you can, by the way, with yoga or meditation, it can help you to monitor your circulatory system. Yeah, the heartbeat, because there are some hard conditions to note, like some hard signs to note, like now irregular heartbeat. It's very hard for someone who's always busy the entire day to notice that. But if you try out yoga or meditation, yeah, you can notice that maybe my heart is beating abnormally or my circulatory system is not working well. So yoga and meditation may be something important in hypertension. So some drugs used in treating hypertension. Yeah, we have diuretics, we have beta blockers, SCE inhibitors, we have angiostens, 2 receptor blockers, then we have calcium channel blockers, we have alpha blockers, etc. These are the drugs which can be used in treating hypertension. Now we are going to see, like as you see, hello dear, let's stand together, say no to hypertension. Remember, your health is more vital than anything else. Yeah, your health is more vital than anything else. So such diseases like hypertension, this is a personal responsibility. Don't forget to subscribe Quick Online Pharmacy on Facebook, YouTube, Instagram, Twitter. Yeah, subscribe, like and share, and come back the next day for another video about common diseases in the society, in people, and how we can prevent them. What can we see the signs and symptoms, what causes them, how can we prevent them, how can we treat them. Yeah, thank you for watching. Come back another day.